Welcome to the Healthy Choices Policy Directive Reward and Recognition 2023 webinar. The Healthy Eating Advisory Service is delivered by the National Nutrition Foundation, formerly known as Nutrition Australia, Victoria, South Australia, Tasmania and West Australia Division. HEAS is supported by the Victorian Government.
Thanks. So thank you for attending our webinar today to celebrate Health Services Policy Directive progress for the last couple of years. For those of you that I haven't met, I'm Bridget, a dietitian and nutrition policy advisor at the Healthy Eating Advisory Service. And I'm also joined today by a number of colleagues and stakeholders who I will introduce throughout the session. So I would like to begin today by acknowledging the traditional custodians of the land on which we meet today and pay my respects to their elders past, present and future. And I extend that respect to Aboriginal and Torres Strait Islander people here today. So we have a really exciting session here today and a fantastic opportunity to promote the 2023 results, which we're so excited to share. And I think you'll all be really pleased. We'll also outline ongoing reporting requirements and provide some updates around catering and the HealthShare Victoria option for health services as well. So it's fantastic to see so many health services represented. We've had about 85 people register to attend today and some of those unable to make it. So we will be distributing a recording as well for everyone. So you can watch this for a second time if you feel like it. There will be an opportunity at the end of the session to answer questions. So please add your questions to the chat function and we'll get to those. Or if you have something nice to say about something that's happened today, put that in there as well. It's good to have that there as well. So I'm going to introduce my Department of Health colleague, Rita Alvaro, the Senior Policy Officer. And Rita will begin by stepping us through some results, some recognition and a discussion around the ongoing reporting requirements. So Rita, if you're ready, I've got your slides.
Thank you, Bridget, and thanks for the introduction. It is a pleasure to be with you here today and great to see so many people joining this session. As Bridget mentioned, in today's session, we're not only going to be providing you with an update on the Healthy Choices Policy Directive, I'm going to be sharing with you some of the outcomes of Phase 2 reporting. And more importantly, this is an opportunity to recognise and celebrate the outstanding efforts of health services in implementing the Healthy Choices Policy Directive. The next slide is simply a refresher of the Healthy Choices Policy Directive. So as you may recall, the Policy Directive applies to all Victorian public health services and site services under their management, including hospitals, public sector residential aged care services, and also integrated community health services. It aims to ensure that staff and visitors have access to healthy food and drink options. And there was a phased approach to implementation, with the directive being phased in over 2 years. Phase 1 drinks targets were set for the end of 2022, and these included having at least 50% green drinks and removing sugary drinks from in-house retail outlets, vending machines and catering. So you may recall that at this time last year, we were celebrating that there were 88% of health services that met the drinks target. So we thought that was fantastic. Phase 2 added food targets set for the end of 2023. These included increasing the access to healthier foods for staff and visitors, namely having at least 50% green foods and no more than 20% red foods through retail, vending and catering. So I would like to take the opportunity to thank you all for your hard work in not only implementing the Healthy Choices Policy Directive, but also reporting on your progress against meeting these targets. Next slide, thanks, Bridget. So the reporting that you have all done has enabled the collation of statewide results. So today we're very pleased to announce the statewide results of the Phase 2 and final targets of the Policy Directive. You can see them on the next slide. So due to the hard work of health services, including all of you, as well as the support from the Healthy Eating Advisory Service, we can now share that as at the end of 2023, there were 99% of health services that met all the Healthy Choices Policy Directive targets for both food and drinks. There was one service that didn't, but they were very, very close to meeting. If you break this down, 100% of health services with in-house managed retail met the requirements for in-house retail. 98% of health services with vending machines met the requirements for vending, and 100% of health services met the requirement to have a catering policy. So this is simply remarkable. The next slide. Thanks, Bridget. So I would like to just take a moment to congratulate all health services for your commitment to increasing access to healthier food and drink options. This important work, as you know, supports the health and wellbeing of staff and visitors of your service. And we're pleased to say that there will be a certificate coming your way that acknowledges the important work that you've undertaken to meet this policy directive. Next slide. Thanks, Bridget. So in terms of what happens next, due to this very amazing effort of all of you in health services in meeting the phase 2 targets, from here on, it's simply a matter of your effort going to maintaining these great efforts. So this will include continuing to ensure that you meet the food and drink targets, for example, whenever you update your retail menu, or for example, whenever you get a new vending machine. It's also about ensuring maintaining the integrity of your healthy eating or catering policy every time that it's reviewed, and continuing to ensure that staff are aware of this particular policy as well. To ensure your great efforts continue to be recognised, the department will continue to require ongoing annual reporting on the Healthy Choices Policy Directive. And I can let you know that the reporting requirements for this year and for beyond will remain very similar to last year. So this will include reporting on your progress against food and drink targets for all your in-scope sites and services via Progress Tracker in the September reporting period. And it will also include ensuring you've undertaken or updated your retail and vending assessments in the 6 months prior to the reporting period as well. As per the last couple of years, any further information on the detail, for example, around undertaking assessments or reporting, will continue to be communicated to you via the Healthy Eating Advisory Service. So next slide, thanks. So now that we've, gone through, these remarkable statewide results and provided you some updates on reporting, this now brings me to the very exciting part of today's session, which is about recognising the outstanding efforts of 4 particular health services. This is our first year that we are recognising health services' commitment to meeting the policy directive through 4 new award categories. The award categories are excellence in innovation, excellence in quality outcomes, excellence in collaboration, and excellence in leadership. So our first award, next slide, thanks, goes to La Trobe Regional Health for their work in innovation. La Trobe Regional Health developed a whole new culturally appropriate menu with extensive stakeholder consultation as well as student support. So well done to La Trobe. You may want to raise your digital hand if you're here. So congratulations to all involved with that work. The next award for excellence in quality outcomes goes to Peninsula Health. And Peninsula Health undertook an extensive implementation of the policy directive, including in both their internal and external retailers. They also involved an extensive working party to make sure these changes were sustainable. So congratulations, Peninsula Health. The next award for collaboration goes to West Gippsland Healthcare Group. West Gippsland Healthcare Group implemented the policy directive with comprehensive collaboration involving an extensive team in regular working parties, including the health promotion team. This allowed them to comprehensively update their menu and positively change their food and drink supply. So congratulations to West Gippsland. So lastly, the award for excellence in leadership goes to Western District Health Service. So many health services here today would have already benefited from Western District Health Service's generosity and mentorship, namely through the provision of green recipes and support, which has assisted other health services in best practice implementation. So overall, congratulations to these 4 award recipients, and also to each and every one of you for all the great work that you've done in implementing and meeting the policy directive. So in summary, this will be my last slide for today, but I would like to acknowledge all of your commitment to modelling the promotion of health and wellbeing through providing healthier food and drinks and meeting the policy directive. I would also like to acknowledge the outstanding comprehensive support provided by the Health Eating Advisory Service, which I'm sure you have all appreciated. A special call out to Bridget, who has supported all of you, and also to people from the Health Eating Advisory Service behind the scenes that have helped make this happen as well, such as Kirsten, Margaret, Deepa and Caitlin. So what I know is that the support from the Health Eating Advisory Service has been crucial to this policy success, as well as all of your hard work. So on that note, I'd just like to thank everyone, and I'm going to hand you back over to Bridget.
Thank you, Rita, and a big congratulations to all those health services that received awards. It's been particularly difficult staying tight-lipped when I've been speaking to many of you over the last few weeks, so congratulations. And in addition to that, remaining tight-lipped on those fantastic results, I'm so happy to be able to share those all with you. You've worked incredibly hard, and it's so great to see those reflected at a state level. So congratulations once again. So I will now introduce Jessica Johns, Category Manager from HealthShare Victoria, or HSV, and Jess will present to us today on the role of HSV and how health services can utilise HSV to procure the healthier products they require. So I've had discussions with many of you about HSV and the role that they can play, but Jess will also introduce HSV and what they do for those that are unfamiliar. So Jess, I'll hand over to you now.
Thank you, Bridget. Congratulations, everyone. That's very impressive, those results. And I know that on that, it has been challenging sourcing the products. And so for everyone to be able to achieve those results, it's just amazing. And thank you, Bridget, for your help and guidance as well. I'm sure a lot of us wouldn't be where we are now with those results without your coordination as well. So with HealthShare Victoria, we provide services and procurement along with the supply chain to health services that are either mandated or eligible in Victoria. So both clinical and indirect products and services. With catering supplies, the category that I manage, we have a collective agreement across the state to provide food and beverages, with regional health services being out of scope for fresh food, produce, meat and bread. High-use items on the contract have been classified with the amber and the green classifications that Bridget has done, and we do aim to do more classifications in the year coming. And supplies on panel are also across the classifications, and they may have options for you as well. We are looking into, look, they're very aware, we've had conversations. The challenge is sourcing it as a bulk product. What we've realised, though, with access to the information and the products, it's not consistent throughout the sites. I just wanted to remind everyone that portal access rights are determined by the health services, where super users are responsible for setting up accounts and the access levels. And the pricing schedule and communications are available to those users. So those, I understand that a lot of us on the floor may not have access. So if you could seek out the users on your site and ask for access, it would be very handy. Because there's also option to favourite the category as well, in which case when there's communications that come out, you'll be notified. That's about it from me. Unless anyone's got any questions.
Fantastic. Thanks, Jess. So if anybody has any questions, please put them in the chat and we'll have the opportunity to ask those to Jess at the end. I guess it serves as a good reminder within health services to be aware and be able to sort of identify your procurement pathways or the ways in which your health service obtains food and drinks. And just flagging as well, Jess, and you can add more detail to this, but HSV serves predominantly there for inpatient and residential meals, but health services do have the option to access HSV for their internally run retail outlets as well. That's correct, isn't it? Yeah. Fantastic. Okay. So if there are health services having trouble procuring the products that they need, be in touch with myself and I can link you in with Jess or your relevant HSV rep. But I guess if you take one thing from Jess's presentation, it's identifying who in your health service is responsible for accessing the HSV portal, because that will make your life a lot easier. Thanks so much, Jess. And please, any questions in the chat and we will answer those. I will now hand over to, let me just stop that. I will now hand over to my colleague, Grace Hamp, who is also a nutrition policy advisor and will present to us on the Catering for Good directory. So Grace will explain to us what the directory is and what the opportunity is for health services. So Grace, I'll hand over to you.
Thanks, Bridget. So good morning, everyone. My name is Grace, and as Bridget mentioned, I'm a nutrition policy advisor at the Healthy Eating Advisory Service for sport and recreation facilities, as well as workplaces. Before I continue, I would also like to acknowledge the many lands on which we're all gathering from today. So for myself, that is the lands of the Wurundjeri or Warring people of the Kulin Nation, and I extend my respect to their elders past, present and emerging, and of course to any Aboriginal and or Torres Strait Islander peoples here with us today. So I'm excited to be introducing to you all the Catering for Good directory. So the directory was developed by the Healthy Eating Advisory Service with support from the Department of Health. And the directory aims to support Victorian organisations to access healthier and more sustainable catering options. And as demand for healthy and more sustainable catering options continues to grow, the Catering for Good directory will provide exciting opportunities for catering organisations across the state to grow their business by connecting customers to them who are looking for catering that's good for people, good for the environment, and good for the community. So health services can search the directory map to find catering businesses that have assessed their menu using Food Checker, allowing for healthier menu items to be showcased and promoted on the directory. And although not a requirement for caterers to be listed on the directory, caterers can also identify whether their business is a social benefit enterprise. So caterers can select whether they identify as a certified social enterprise, meaning a social enterprise certified by social traders, or a Victorian Aboriginal business, meaning a Victorian Aboriginal and or Torres Strait Islander owned business. Caterers also have the opportunity to identify their sustainable business practices where relevant. And just to reiterate, a caterer doesn't need to identify as a social benefit enterprise to be eligible to be listed on the directory. And any caterer located in Victoria that can offer healthier catering options can be listed. So all catering options listed and promoted on the directory are green and amber options according to their Food Checker classification. Next slide, please, Bridget. So I'm excited to showcase to you all a new resource that has just been made available. This is a video introduction of the Catering for Good directory that I thought would be fantastic to showcase to you all today. So ready to hit play whenever.
Are you a caterer or food business based in Victoria? You can now be part of the movement to create a healthier and more sustainable community for all Victorians and have the opportunity to grow your business at the same time. Introducing the Catering for Good directory. The Catering for Good directory is an online directory of caterers. developed to help Victorian workplaces access healthier and more sustainable catering options. The Catering for Good directory will also showcase organisations that are certified social enterprises and Victorian Aboriginal businesses. By applying to be listed on the directory, you will be visible to workplaces across Victoria who want to provide healthier and more sustainable catering options to their staff and visitors. To register your business, you need to follow a few simple steps, which the Healthy Eating Advisory Service is here to support you with. First, visit Food Checker to assess your menu against the Healthy Choices guidelines. Food Checker uses a traffic light system to classify different food items as either green, best choice, amber, choose carefully, or red, limit. Your green and amber items assessed will be displayed and promoted on the directory, but no red items will be promoted. This is in order to help workplaces view and order healthier food and drink options. Then visit the Catering for Good webpage and complete an application to have your organisation listed on the directory. Once approved by the Healthy Eating Advisory Service, Victorian workplaces will be able to find catering organisations like yours for their next meeting, event or function. And if at any point along the way you get stuck or have questions, don't worry, the Healthy Eating Advisory Service is here to support you. You can contact the Healthy Eating Advisory Service at cateringforgood@nutritionaustralia.org.au or call us on 1300 225 288 or head to heas.health.vic.gov.au/catering for good to find out more about applying to have your organisation listed on the Catering for Good directory. So, to help grow your business and support a healthier and more sustainable Victoria, visit heas.health.vic.gov.au/catering for good today.
I'll stop sharing if you're happy to present the slides, Bridget. Thank you.
Bring those back up. We'll see those now and I'll go to the next one.
Fantastic.
Oh.
And after today's presentation as well, I'll be dropping the link to that resource in the chat function. So you're welcome to go and view that video again as well. Now we have the opportunity to have a look at what the actual directory looks like, which is really exciting. So as you can see on the left-hand side here, we have a list of caterers that can be populated and searched for via their social benefit enterprise status. So whether they're a social enterprise or whether they're an Aboriginal-owned business. And then on the right-hand side, we have the map function where you're able to scroll and click on a certain business depending on location. And then you can see you've got the legends there as well, identifying the icons and what their relevant meaning is. So the directory is now live. You can actually access the directory yourself via the Healthy Eating Advisory Service website. And then if we go to the next slide, Bridget, I'll showcase what an actual caterer listing looks like on the directory. So you have the contact details of the caterer listed at the top. You have some instructions as to how to actually place an order through that caterer. And then on the right-hand side, you have your menu options that have all been classified by a food checker as either green or amber options. And then towards the bottom of the caterer listing page, you have the sustainable businesses and practices that have been implemented by that business. And ultimately, you head through to the caterer's website to place your order. And if we head to the next slide. Thank you. So how can Catering for Good help with the policy directive? Well, firstly, you can now search the directory, which is live, for local caterers who can provide healthier catering options for your health service. Beyond ordering healthier catering options, you can also find businesses that implement sustainable business practices and deliver social benefits to the community. So I'm excited to have been given the opportunity to present and introduce the Catering for Good directory to you all today. As health promotion and industry professionals, we would love your support to promote the directory to any caterers you use in your health service that should be listed. So you can support caterers in your community and in your health service by supporting the identification of caterers used in your health service, which should be listed on the directory. And you can also support caterers directly yourself in applying, for example, with assisting with menu assessments in Food Checker, or you're welcome to provide an introduction to the Healthy Eating Advisory Service team and myself as well. Ultimately, the benefit to caterers to join the directory is the exciting opportunity to grow their business and be visible to workplaces across Victoria who are seeking healthier and more sustainable catering. And we also know that this is a fantastic opportunity to support regional and rural catering businesses who serve your health service, but who can also serve the wider community. So after today, if you'd like to find out more about Catering for Good or have any caterers who you think would be interested in applying, I suggest viewing the resources I've listed on the slide, and I'll make sure to add those to the chat function. And if we head to the next slide, you're always welcome to contact myself via the number listed or via emailing cateringforgood@nutritionaustralia.org.au. And to find out more, we can also send it via the chat function the relevant links to find out more about what Catering for Good is all about, as well as what the application process involves and the support that's available for caterers and for you as health promotion professionals as well. So I'll hand back to Bridget now.
Thank you, Grace.
Thank you.
Thanks. It's a really good opportunity for health services to have had that presentation from Grace about the Catering for Good directory. I know I've spoken with a lot of you about it individually, but I think there's a huge opportunity here for health services. So be in touch with Grace directly or let me know and I'll put you in touch with her as well. So that is an excellent opportunity. So that sort of brings us to the end of our formal part of the session today. So thank you for joining us. It's been a fantastic opportunity to celebrate and recognise the great work of health services and provide some exciting updates. I have been monitoring the chat function and there doesn't seem to be any questions, but whilst I finish wrapping up, if anybody has any questions, please put them in there. So as Rita mentioned, all health services will receive a certificate for their work with the policy directive. So I will be sending those out in the coming days. And that's a great thing to share with your leadership or display on a wall or just have for recognition. It's really important to have the great work that you've all done recognised. And just by way of a further update, so at the end of last year at HEAS, we conducted a needs assessment to understand what health services required to maintain the policy directive going forward. And a big thank you to the health services that participated in those interviews. So the good news is that we are in the process of compiling all that information and those needs and now going forward to develop the content and the resources that have been identified from that process. So we'll have lots of those to share with you specifically around maintaining the policy directive. So you'll certainly hear from me when they're available. I'm just going to have a peek at the chat and see what we've got coming through. So excellent video. An update on the evaluation from the policy directive implementation. Rita, I don't know if you'd like to speak to that point.
Sure. So there's various things happening through Progress Tracker. There is a lot of information there. So I just presented today the very high level results for you that 99% of health services have met, but there is a little bit more detail than that. And we are producing a summary report that goes through that, similar to last year. So that should be available through the health.vic website in another month or so. So look out for that, but we will also notify everyone via the HEAS e-newsletters when that is out as well.
Fantastic. Thanks, Rita. Any of the data from the needs assessment be shared? Rita, I'm not sure if you have anything that you'd like to add to that.
Is that
I
me?
can probably
Kirsten,
I can always talk to that one, Bridget, if you want me to.
Yes.
So yes, this is just wrapping up in terms of the health services that participated in the interviews that Bridget and Deepa as well conducted late last year. So we will be sharing, I think, through our newsletter and any upcoming information that we'll be sharing, we might share some topics that we would like to be developing from the needs assessment, because it will relate to all of you, and we will be reaching out as well at various time points to get some feedback to make sure that it is hitting the mark in terms of what you're all after. but I guess mainly just creating resources. Online training is also something that we'd like to do around maintaining the policy directive requirements moving forwards. So we'll definitely be in touch with sharing those resources anyway, and reaching out to some of you for some feedback around that. Yeah, thanks, Annalise.
Thanks, Kirsten. So I think quickly put any last questions in if you have them, but just a final word to say congratulations again and thank you everyone for their hard work, and to the wider team at HEAS and the department that support this policy directive work behind the scenes. There's a lot of moving parts, and yeah, it's great to have everyone's support. So don't hesitate to be in touch if there's anything else that we can help you with. We've got meetings locked in with health services to continue to work towards the policy directive. So yes, look forward to continuing that in 2024. If there's no further questions, we'll give everyone back some time, and yeah, continue to work from there. But yes, well done everyone, and we'll be in touch with certificates and a recording from today.